This project introduces a novel scoliosis bracing treatment, which is a flexible brace with artificial hinge. Scoliosis is a complex three-dimensional deformity of the spine. A diagnosis is made when an individual has a cup angle of the spine that is equal to or greater than 10 degrees. About 3% of adolescents worldwide have scoliosis. In China, scoliosis affects about 2.9 to 8.4 million adolescent population. Scoliosis affects the body profile, causing an asymmetric spine-deformed trunk, uneven shoulders, and a tilted pelvis. Severe scoliosis may cause spinal pain, affect cardiac and pulmonary functions. To treat scoliosis, bracing is a universal non-invasive treatment. The goal is to stop the progression of the spinal curvature during puberty. If the curve of the spine is more than 45 degrees, surgery may be required. Rigid brace is an effective treatment, however it restricts mobility. It is uncomfortable to wear, may cause pain, and irritate the skin of the wearer. So to find a solution that would overcome these problems, we have developed a flexible scoliosis brace based on clinical applications, materials science, and garment technology. It allows for a better treatment experience. So compared to the rigid brace, our brace is more comfortable, more flexible, and less expensive. The proposed design is a tightly fitting garment that applies pressure onto the spine. The artificial hinge stabilizes to corrective panels. These panels provide external forces that push the body against the spinal curvature. The pelvis belt is placed around the hips, providing the endpoint control of the pelvis. The brace also has a front opening bra top. The open gusset design allows the wearer to use the toilet without inconvenience. All of the straps on the brace can be adjusted and allows the perfect fit for any body size. Let's see how the flexible brace works. A 3-point pressure system is used. The corrective panels are positioned at the apical vertebra on the convex side, above and below this point on the other side of the body. The open design on the concave part of the brace allows room to expand, which promotes the efficacy of the spinal correction. Our clinical study consisted of 2 phases, a 2-hour clinical study and a periodic monitoring study. The first phase involved 4 subjects. The in-brace correction rate ranges from 9.7% to 87%. The posterior trunk asymmetry index was measured in the 3D scanned images of the subject. The initial rate of correction of the asymmetry can be as high as 43%. After 3 months, as shown in the ultrasound images, the angle is reduced from 28.1 to 13.3 degrees. Her body is more balanced too. When we compared our brace with rigid braces and spine core flexible brace, after 3 months, our brace reduces the spinal curvature by 53%, while the rigid brace reduces the curvature by 17% and the spine core brace only 12%. As for the cost, our brace is about 2,000 Hong Kong dollars, while other braces are far more expensive. Moreover, our brace does not require a long production time. For our future plans, our first goal is to conduct a randomized controlled trial with 100 subjects. The second goal is to commercialize and getting FDA and CFDA approval. This project will also see collaborations with universities and hospitals in Hong Kong, Shenzhen, Shanghai, as well as the United States. As for the prize money, we will use the funds to develop marketing materials and go towards meetings. Thank you very much. If you have questions, please contact Dr. Joanne Yin.